let me give you an overview of healthcare in U.S. There's two types of healthcare. Usually, there's a private healthcare, usually through employer, and relative. Yeah, the employer will subsidize certain amount of a certain percent, a big portion of the healthcare cost. And then there's a public type is healthcare, Medicare, which I think is subsidized by taxpayers' money effectively. Um, and then go to people who are older or low income. And then in practice, there there are in practice you need to find the insurance and then find what is in network. You go have a cascade, effectively a cascading way to find a person to find care. First is primary care. You have your annual checkup, and then if there's anything wrong, you will go to the specialist, and then if you need a surgery, you will go to a surgical center. So the location will effectively going from like a clinic or office for primary care, and then you go to a clinic for a specialist, and then a hospital for a surgical center. It will take you days to schedule primary care, take weeks for a special care, and the hospital surgical care will be much closer. The cost is cascading in terms of cost, escalating in cost in terms of like you start with primary care, we're up for the $20,000 copay, $50, and then in the thousands. Then with insurance, you will have $100. Without insurance, you will pay $100 for primary, $100 insurance, and then almost infinite for surgery in a surgical center. Without insurance, but copay you probably capped a certain amount. And then this is just a normal standard way. But if you have an emergency, something that is not life threatening, you can have a walk-in for emergency care clinic. It will take minutes for you to get care, and it will cost $50 roughly copay, and then roughly $100 without insurance. For ER, you can walk in, and it's a life threatening. You might die if you don't get the care immediately. Then you will get, say, call 911, and they take you to ER, and then it will cost you copay in terms of roughly $200, and without insurance roughly thousands. Then if you're unconscious, for instance, they will take you to the nearest hospital, and the insurance will take care of the bill. At least that's what's supposed to happen. That's what I know by talking to ChatGPT. Then this is a very neat way to calculate the cost. So you have effectively two bars. One number is called deductible. Until there, you pay the total amount. Like this, the y-axis is the cost out of your out-of-pocket for you. Sorry, the y-axis is out-of-pocket, so pretty much how much you pay out of your own pocket. And then the x-axis expense is like how much the hospital or clinic will charge. So before deductible, how much you will charge equals to the out-of-pocket, so you will pay 100% of that. And then between deductible amount to the deductible limit reached to the out-of-pocket maximum, you have a co-insurance, meaning the certain percentage you will pay certain percentage of the cost. I don't know, say 20%. You pay the additional between those, you pay the share the cost with the insurance, like the certain percentage you pay for that. And then after that, it has out-of-pocket maximum, like say over $8,000 you pay out of your pocket. Then whatever comes, the insurance pay it all. You don't pay a single dime out of your pocket after you reach out-of-pocket maximum. So that's effectively a 3-tier list. One is like out-of-pocket completely, the expense, and then you share the cost with the insurance, until you reach to the maximum out-of-pocket maximum, and then the insurance will pay the rest completely. So this effectively is the almost a mathematical formula. So less than deductible expense is equals to the out-of-pocket equal to the expense, and then the deductible plus co-payment, deductible maximum plus co-payment, when there's like in between this region, and then out-of-pocket maximum just become a constant. You just don't pay additional after the total expense exceed the out-of-pocket maximum. And then as your age, you wanted to for a doctor, you just want to, when you're younger, I think you only need like an annual checkup for primary doctor. When you get older, you need some preventative care, do the bone density mammogram and the colonoscopy. But primary care doctor will give you a suggestion, and then you can transfer the info if you change location or retire. If the primary doctor retire or changes, you can ask for a referral to go to a different primary doctor. Your primary doctor, which means they're the point of contact, they talk to you, they know who you are, and then they will continuously update and know your historical data. So when you get older, when you get no employer, your premium will go up quite a lot, or you'll retire early. Before, if you are 65 plus, the Medicare will cover most of the costs. That's a 20% copay and no out-of-pocket maximum. This is dangerous because when you're older, I mean, say you get a giant surgery, then if there's no out-of-pocket maximum, you can theoretically pay infinite amount of money, which is dangerous in my eyes. So that's a package part A, B, and another thing is called Medicare Advantage, which is apart from A, B taking care of prescription, preventative care, prescription doctors, it has a $3,500 out-of-pocket maximum. So you just pay. You pay up until $3,500 this year, and any additional cost other than that, you will pay effectively. The insurance will cover it. So in terms of cost, as of now, 2025 is $150 per month for package A, B, and then for package C is additional $50 per month. So in order to there's other supplement, it's called Medigap, and supplement vision, hearing, and the dental. Then you have to just check your own different other insurance for those type of care. If you retire early, you have to pay out of pocket yourself. These are pretty expensive, I think in the order of $300 per month. So this is what U.S. healthcare works. Just to recap, this is a cascading way: going clinic, primary care specialist, and surgical center, and then if you have something urgent but not life-threatening, go to urgent care, which is much significantly cheaper. You can see order magnitude. If it's life-threatening, you might die, go to ER, it will cost significantly more. But fear not, you have a tier list, effectively, a tier list of expense, out-of-pocket expense, and there's 3-tier functions. And then when you grow older, you might want to do other preventative care like bone density, mammogram, and colonoscopy. When you get older, you have Medicare because you have no employer, but part A and B take care of the normal things, but A has no out-of-pocket maximum. With the C, it has $3,500 out-of-pocket maximum. So Other than that, you still may want to have some type of supplemental healthcare like vision, hearing, and the dental.